I will recommend a doctor what they can do in the future for its own life to make richer his own professional development. I think that the best is go to humanitarian. And one of humanitarian organizations is MSF, is Doctors Without Borders. During conflict and disasters, it's very important the role of anesthesiologist. This is because when you have a disaster, for example, as an earthquake, or a conflict where you have war wounded, mainly patients come with trauma. Not only trauma, because also we know that a lot of women will need cesarean sections, but for all this we need surgical care. And an important part of surgical care is anesthesia management, and therefore being anesthesiologist is very important in this context, and being anesthesiologist is a profession that is very, very needed in the field when we have this kind of situation. Working in the field is difficult for everyone because, of course, the situation that we have in our home countries is completely different to the situations we might find in the field. However, I need to say that being an anesthesiologist, I left my country thinking that to work as an anesthesiologist in the field might be difficult. And actually, it's not like that. It's not like that because providing anesthesia is the same in our countries as in the field. You know, you intubate the patient the same, you make the patient sleep the same, you give pain management to a patient the same. So I think that working as an anesthesiologist is more or less the same that we do at home, but the only problem here will be the environment where we work. Sometimes we don't have the same biomedical devices that we have at home. Sometimes we don't have human resources so qualified as we might have at home. And also, sometimes we might use drugs that we are not used to use them at home. But as an anesthesiologist, I can say that the work is the same. In the field, we anesthesiologists are very, very flexible. In MSF, actually, the word flexible is very used because all of us, when going to the field, we are multitask people. Anesthesiologists, we also do a lot of times emergency medicine. I understand that a lot of us might not be used to do emergency medicine, but in the field, when almost there's no more doctor, we anesthesiologists were the best posted to do that. Also, in a lot of contexts, we might do intensive care. And anesthesiologists also, we do several things. We also, for example, we check how the sterilization is done. We check our supply in medical and consumables in the operating department. Also, we might check what is going on in the services. But one of the important things we, as anesthesiologists, we do is to train people. We need to understand that in the developing world, there are not so many anesthesiologists. And even though there are very smart people, mainly nurses, that can be trained to do safe, quality, and simple anesthesia. And I think it's one of the big challenge we have, but I think is one of the best things we do in the field. So if you would like to do something else, something rewarding for you, something that will give you fantastic memories afterwards, apply to work. Go to the website,